So today I want to go through what we talk about during our consultation for eyelid rejuvenation. We have our beautiful model Stephanie here, and we have some anatomy drawn on her face to help guide through the education of what we talk about. Patients come to me often and just say, my eyes look tired, I don't feel tired, how can I make them look refreshed without changing their shape? And we'll look at the upper eyelid and how that relates to the brow, as well as the lower eyelid, so everything stays in harmony and balance, because that's what makes a pretty result. So when I'm looking at someone's face, we start looking at the upper eyelid skin. And you can see there's over that fold there, as we age, that skin will start becoming excess and folding over. And when we do that, that makes the patient an excellent candidate for an upper lid blepharoplasty. What we do there is you make an incision, close your eyes for me, right where the skin folds over itself, completely hidden in this crease and a little past the corner of the eye. And through that incision, you can open your eyes, we can remove the excess skin. Once we remove that excess skin, we'll see the second layer that's just underneath the skin, and that's these muscle layers here. And you can see here we have drawn out the muscle called the orbicularis oculi muscle that goes all the way around the eye. It acts like a purse string to close the eye. And then there's the frontalis muscle here in the forehead, and the corrugator muscles here that we treat with Botox to get the 11s to go away. And once we remove the skin, we'll see this red muscle underneath. And a lot of surgeons will then trim that muscle to take away a little bit of excess, you can close your eyes, right through that area too, to show more eyelid. But I do not like doing that because it can cause more hollowness. Even though it shows more eyelid, it can look more aged when you do that. And it can have functional problems down the road. So we really avoid removing that excess muscle. Underneath the muscle are fats. This is the third layer. And you can see on the upper eyelid, there's a pocket of fat here that sometimes bulges. There's a pocket of fat here that sometimes bulges. And there are 3 pockets of fat on the lower eyelid. And then on the outside corner, there's this gland here, the lacrimal gland, that makes tears for our eyes. So we want to make sure we leave that alone. And we really want to leave that fat in that third layer alone on an upper blepharoplasty as well, because we don't want to hollow out your eyes. But for some people, this nasal fat pad, the one very close to the nose, does bulge over time. And that fat is independent of the fat on the rest of your body. So whether you gain weight, whether you lose weight, it's not going anywhere. So oftentimes we'll make a little hole inside the muscle so that we can get to that little pocket of fat, and we tease out a little bit very conservatively and trim it out, and that fat bulge will go away. And that's how we treat the upper blepharoplasty. Now, oftentimes there'll be a lot of excess skin on the outside of the eyelid here. And patients will think, oh, we can just take the incision all the way out to the side to get more skin. But that can have 2 negative effects. One, if you take the incision too far out, it can make a longer, more visible scar, which we don't want. And 2, if you take out too much skin, it can start pulling the eyebrow tail down. So we have to combat that by adding support. That's why when you come in for an upper blepharoplasty and you're over the age of 40, generally we need to do something called a temple lift, where we make an incision behind the hairline and lift that brow up to support the brow so it doesn't get drawn down, and also so that it can unravel the skin so we don't have to make the incision too far out past the corner of the eye. So that's why a temporal lift is often very much married to an upper lid blepharoplasty. Whenever we rejuvenate the upper eyelid, we really have to look at the lower eyelid as well to make sure that things are harmonious and balanced. And oftentimes when there's aging in the upper, there is aging in the lower. And what do we see there? Sometimes we see excess skin, but we also see shadows. And the shadows are what really make us look tired. And the shadows come from 2 things, the bags. Fat pockets. 1, 2, 3 separate fat pockets on the lower eyelid. That is, again, fat that's independent of the fat on the rest of your body. Whether you gain weight, lose weight, it's not going anywhere. And those fat bulges can bulge out and create a shadow. Oftentimes right underneath this bone of our orbital rim, you'll also see fat being lost in the fat pockets here in the tear trough underneath the cheek. And that can cause a trough. So when you have a big bulge and a low trough below it, it makes a big shadow. So that's where we do a very cool, scarless lower lid blepharoplasty, where we don't have to cut on the skin necessarily. We can go from inside the eyelid and find these 3 little pockets of fat, and we tease out the excess. Either we cut it out, which we often do, or we can redrape that fat down to fill in the trough. But if we cut them out, then usually we take a little fat from the abdomen or the inner thighs, and then we can inject fat, not here where we remove the fat, but where the troughs are underneath it. And by doing that, we've brought the bulge down, the trough up, and we've evened out the texture and the shadows significantly. It'll never be 100% even, but we know with fat transfer in this technique, we can get them very, very smooth. So that's how we treat the upper eyelid, lower eyelid complex together with a temporal lift to look rejuvenated and still like yourself.